Okay, I think we're going to go ahead and get started. Looks like we've got a pretty good group on the call. This is Aaron Warnham with Montana Healthcare Foundation, and this is the 2017 Call for Proposals Large Grants webinar. Thanks so much for making time to be with us today. So, as we're getting started, just want to give you some technical notes about how the webinar will work. If you're having any trouble with the audio, or you're hearing an echo or feedback, try muting your computer speakers and dialing in on the phone line. The number is right here. It's 408-638-0968. Webinar ID is 799-335-450. We're going to ask that everyone submit their questions using the Q&A feature on the upper left corner of your Zoom interface, just so we don't have everybody talking all at once. And if you're having any technical problems during the webinar, you're free to use that Q&A feature as well, just to send us a message and let us know. We'll try to troubleshoot that with you. So I'm just going to start by introducing the staff here at Montana Healthcare Foundation. I'm Aaron Warnham, I'm the CEO. Ted Madden is our Chief Operating Officer. Scott Malloy is a Senior Program Officer who leads our behavioral health work and a lot of other programming as well. Kayla Talbert is our Grants Administrator. And Melinda Buhite, who's here with me helping with the webinar today, is our Communications Coordinator and also an Executive Assistant. So just some logistics about how the flow of this webinar will work. It's an hour long. The first 30 minutes or so, we'll plan on just giving you a presentation. And actually, Ted and Scott aren't with us today, so it'll mainly be me talking at you. Then for the last half an hour or so, we'll try to make plenty of time for all of you to ask your questions. We want to leave plenty of time for questions. We really encourage you to ask any question that comes to mind, and we'll do our very best to answer them all. We want you to submit the questions by typing them into the Q&A feature on your interface anytime throughout the presentation and during the Q&A session. After the meeting, we'll send out an email with today's slides and a link to the presentation recording and any responses to unanswered questions from the Q&A session. If we don't have time to get to your question, or if we aren't able to come up with a real good answer during the webinar, then we will do our very best to send out any missing responses after the webinar. The webinar slides and recordings are going to be posted on our website, so if you feel like you missed anything or there's someone else you'd like to share them with, it should be easy to access. Again, here's the agenda. I'm going to cover just some of the basics, an introduction to the Montana Healthcare Foundation, our eligibility and selection criteria that we use to look at every single grant and make a decision, our focus areas, and then just the nuts and bolts of how to use our online application system to apply. These are our goals for the webinar. We really want to help applicants understand our focus areas and our approach to making grants. We want to make it as easy as possible for applicants to apply by explaining the timeline and the online application process. And we want to answer any questions that you might have that could be helpful to you as you put together your ideas for a project. We want to emphasize we try as hard as we can to be helpful with the grant application process. We don't see any value in making it challenging or creating hurdles just for the sake of filtering people out. Our goal is to help you put together a great proposal, and most importantly, our goal is to fund work that's going to improve the health and healthcare of Montanans. So this is just a little bit about the Montana Healthcare Foundation for those of you who haven't worked with us before. Our overall purpose is to make strategic investments that improve the health and well-being of all Montanans and strengthen the healthcare system. We focus on at-risk populations and health disparities, so people who are particularly vulnerable and have higher rates of illness are a major focus across all of our work. We are the largest Montana-based foundation that focuses on health. Currently, our trust is at about $135 million. We make grants of about 5% of the value of our trust every year. And that's grants and grant-related investments, other charitable investments that include sometimes the direct staff time that we use to help grantees and other stakeholders. But roughly 5% of the value of our trust is spent directly on achieving our purpose of improving health and well-being and healthcare in Montana. We were created from the sale of Blue Cross and Blue Shield of Montana a few years ago, and we don't have any relationship anymore to the old Blue Cross or the new Blue Cross. The HCSC is the new owner of Blue Cross of Montana. We are a separate, entirely independent board. We're a private 501c3 nonprofit foundation. We have three major focus areas in our grant making currently. That's American Indian health, behavioral health, and that includes mental illness and substance use disorders. And within that behavioral health focus, we have two initiatives. One that we started last year, and that's on integrated behavioral health. We'll talk a little bit about that. And the second is on strengthening the substance use disorder prevention and treatment system in Montana, and that's a new focus or a new sub-focus for this year. The last one is called Partnerships for Better Health, and we'll explain a little bit more about what that means. So in 2017, we plan to invest more than $5 million, partly through this call for proposals, but also through invited grants and other initiatives. We expect to give out two types of grants. One is a rapid response grant, and this is a one-step application process that's going to be offered 2 times in 2017, and depending on how much we've spent between the rapid response and large grants and invited grants, possibly a third time later in the fall. And then the large grant initiative, which is really the focus of today, and this involves a 2-step application process with an initial letter of interest, or what we call a brief proposal. And then for those who submit the strongest brief proposals, we'll invite them to do a large proposal in the summer. Any single applicant can submit up to 2 distinct proposals. So as I said, our large grants involve a 2-step application process that's offered only once this year. The opportunity is currently open for you to submit a brief proposal. The grants will be between $75,000 and $150,000 for projects that last between 1 and 2 years. These are generally best seen as a grant to implement a well-planned and sustainable project, and we'll talk a little bit more about what we mean by that. These are the eligibility criteria. In order to be considered for a grant from us, you need to meet one of these criteria. You have to be a Montana-based organization that is either a 501c3 nonprofit, and that excludes private foundations. We don't fund private foundations, and we also don't fund organizations that the IRS terms Type 3 non-integrated supporting organizations. And this is all defined in Section 509A of the Internal Revenue Code. And if you ask me what a Type 3 non-integrated supporting organization is in the Q&A, I might say, Tax-exempt educational institutions are also eligible, and state, tribal, or local government agencies are also eligible. One important note is if you're applying under the American Indian Health Focus Area, you also need to be either a tribal government agency or an American Indian-led nonprofit. Eligible applicants can plan to use part of their budget for contracts with an entity that might not be eligible to apply to us directly. So, for example, if you're not if you have a contractor that's not Montana-based, or you have a contractor that's a private individual and not eligible to apply directly to us, you could use at least part of your budget to fund that contractor, but the applicant still needs to meet these eligibility criteria. I want to spend a little bit of time on this slide. This is probably one of the most important slides in the presentation. And we really use these selection criteria as described in detail in our call for proposals to determine what we'll fund and what we don't fund. In other words, every proposal that we read, we look directly at the selection criteria and try to evaluate the proposal according to these criteria. So the first is the importance of the health issue to be addressed. So we'll ask you to explain not only what is the health issue you'd like to address or the health issues, but why are they important? What makes this particularly important? Why are you choosing this issue to work on in your community? The need, and we look at that according to that the grant would fill a need that can't be met by other resources that are available in the community that you're serving. Sustainability is a very important lens that we apply. So we want to make short-term grant investments that are going to catalyze improvements that endure long beyond the grant funding. We are not the type of grant maker that makes grants to sustain a program that already exists or to start a new program and then re-up to sustain it. We view the strongest proposals as being those that demonstrate a clear and feasible plan to sustain the programming after the grant, and we focus a lot, because we're working in healthcare, on solid business planning and things like third-party reimbursement or generating some sort of shared savings where your partners would help you pay to sustain the program because it's generating so much benefit for them. We focus on creating partnerships. I'll tell you that when you answer your partnerships question, we really urge you to not think about who do you already work with and just not just listing those, but really what is this grant going to do to create or advance new and substantive partnerships that result in more efficient and effective use of resources and better collaboration between organizations that might not typically work together. That doesn't mean you can't also talk about current partners and what they're going to contribute, but we really urge you to think about how is this grant going to contribute to helping you build stronger partnerships. As I said at the start, we focus a lot on at-risk populations and health disparities. We want to see projects where solutions exist. So we look for effective or evidence-based interventions that exist to address the problem you hope to address and that aren't already being used. When we talk about evidence-based, we use a pretty broad definition. We'll ask you to explain why this program will be effective. We don't ask you to cite a bunch of studies. We are often asked in the Native American focus area or the American Indian focus area whether we'll fund culturally based solutions that might not have had a rigorous clinical trial to prove their effectiveness. And the answer is yes, absolutely. We just need to see that there is some evidence underlying your reason for picking this intervention. We look for projects that are workable in Montana and culturally appropriate. So we aren't going to take a program that works great in New York City and take you at your word that it will work great in a rural community in Montana. You'll have to explain, why is this workable in Montana? How is this going to be feasible and well tailored? We also look at scale. So I'll tell you that sometimes we've turned down proposals where we felt the budget was too high for what was being proposed. We've also turned down proposals where we felt the budget was much too low, so it wasn't realistic. We also look for proposals where we feel there's a good chance that if it's successful in your community, it could be scaled around the state and brought to other communities as well. We look to fund ultimately a diverse grantee portfolio, and what we mean is that we'd like to support a range of projects across Montana, so geographic diversity, projects that address different health issues, projects that address both rural and urban problems. So we do use that as one of the many criteria that we're looking at when we make individual grant decisions. And finally, we're looking in any proposal that involves collaboration with tribal leadership. We want to see that that collaboration is real. Just a letter of support may not be enough if you're hoping to address an issue working with tribes or with an urban Indian health center. We want to see that that partnership is real and substantive and that resources will be going to that community. So this is just a list of activities that we do not fund. We don't provide grants directly to individuals. Again, they wouldn't be eligible according to those eligibility criteria from a couple slides ago. We don't fund capital campaigns or fundraising events. We don't fund operating deficits or retirement of debt. We don't currently fund large construction projects or real estate acquisitions, although it is possible that in future years we'll think about certain very targeted investments in that arena. We don't fund fundraising events. We do not fund any type of discrimination. We do not fund lobbying. We're prohibited by the Internal Revenue Service from funding anything that involves lobbying, and we expect our grantees, particularly those that are involved in policy work, to understand those requirements and abide by them. We don't fund activities that involve supporting political candidates or voter registration drives. We don't fund large equipment purchases generally. So there's a caveat here. If you need to buy, for example, computer for a new employee under this grant, that's fine. We just wouldn't provide a grant where the main purpose of the grant is to buy a major piece of medical equipment like a CAT scanner or a van. That wouldn't be appropriate. We don't fund medical research or research that lacks a direct, targeted, and practical benefit to Montanans' health. So there are projects, there's a real spectrum of research from benchtop basic science that might eventually lead to a drug being approved many years down the road. That's not something that we would fund. Other community-based participatory research projects that are expected to actually produce a tangible benefit for the community during the term of the grant, that is something that we might consider. But again, our main purpose is not producing new knowledge. Our main purpose is to improve the health and healthcare and well-being of Montana. We don't fund organizations or foundations that want to use our grant to redistribute via subgrants. I want to just alert you to one particular restriction on our funding that exists in Montana state law, and it can be a little bit confusing. I want to also point you to the link on this slide. We encourage all applicants to read our guidance on what's called supplanting. So the Montana legislature passed a law which prevents foundations in our category from using grants to supplant government funding. By our policy, we don't want to supplant any type of funding. So let's define supplant. Supplant is to supersede or replace. So let's say you have funding for a current program and you'd like to free up some of that funding, so you apply to us for a grant to replace that funding. That is supplanting, and that's not allowed. You can use our funds, however, to supplement or augment funding. So if you apply to a grant from us to build on a program that exists, for example, and to allow you to accomplish some new specific outcomes or deliverables that couldn't be accomplished with your current funding alone, that is allowed. That's supplementing. So it's a nuanced distinction, but it's an important one to think about when you're putting together your proposal. So let's talk about our focus areas in depth. Again, I mentioned American Indian health, behavioral health, and partnerships for better health. American Indian health we've been working on since our first year of grant making. We have worked very closely with tribal health programs, Indian Health Service, urban Indian health centers, and other partners to understand the needs. And these are just some of the things that we've learned over the first few years. We view ourselves as continuous learners, and we're always working very directly and closely with tribes and urban Indian health centers and others to build on and strengthen our program and better understand the needs and the best ways to address them. We know that inadequate funding is a very long-standing problem, and that has led to challenges in the health system and in disease prevention as well. There's a need for technical assistance to strengthen the administrative sort of back end of tribal health systems and urbans as well. So assistance with coding and billing and administration is a high priority that we've heard from our stakeholders and partners. Limited availability of treatment for substance use disorders is another very significant problem in many communities. Challenges facing young families that span the gamut from historical trauma and lack of economic opportunity and adverse childhood experiences and others. Suicide and mental illness being prevalent and challenging problems. Oral health challenges, so limited access to dental care and prevalent dental problems in many communities. And other health disparities, such as diabetes, specific illnesses that are present at higher rates in some American Indian communities. So just some examples of things that we funded. We provided, and there is, by the way, on our website, a list of all of our current grants, and you can filter them by focus area so you can see exactly what we're funding. But we've provided quite a few grants on strengthening the funding and administration of health services and prevention programs with the goal of helping contribute to a strong tribally led health system. Self-determination, so using Public Law 638 to contract or compact with the IHS to provide for the tribe to provide its own services. Providing funding for strategic planning. Grants that address the problem of drug use in pregnancy, which is prevalent around Montana, including in many American Indian communities, but by no means limited to those communities. Injury prevention program with a goal of helping a community establish a strong platform for applying for more sustainable federal funding for injury prevention. Addressing the health and health service needs of urban Indians. And leadership development activity, sorry. So in behavioral health, many challenges among the most common that we hear: limited access to behavioral health prevention and treatment, high rates of behavioral health disorders in the criminal justice system, and fragmentation of the system of care for people with co-occurring mental illness, substance use disorders, and/or chronic medical problems. So we're addressing this through the open call for proposals, but also through our couple of initiatives: integrated behavioral health, strengthening the substance use disorder prevention and treatment system, and then some other areas that are not really true initiatives yet, but things that we've identified as being important opportunities to strengthen Montana's system. So for example, providing effective behavioral health services to individuals who encounter the criminal justice system, and projects that strengthen the regional continuum of care for mental illness and substance use disorders, or SUD for short. Talk to you a little bit more about the Integrated Behavioral Health Initiative. The definition that we use for integrated behavioral health is a team-based approach that integrates primary care, mental health, and substance use disorder treatment in order to improve health outcomes and value. So we really view this as what's often called as a no wrong door approach. We'd like people to be able to come into one location and be treated as a whole person, rather than the more problems you have, the more appointments you have to go to different institutions that don't necessarily collaborate or coordinate care. Under the large grant opportunity, the foundation is offering integrated behavioral health implementation grants. These would be 2-year grants of up to $150,000. And these are by invitation only. So you'd want to talk to myself or Scott Malloy if you'd like to apply for an integrated behavioral health implementation grant. As I mentioned, new this year is our focus on strengthening treatment and prevention for substance use disorders. We are really emphasizing the idea that this is a diagnosis that should be viewed as other chronic illnesses like high blood pressure or diabetes. We'd like to see it moving into primary care, and especially into settings that can offer an integrated team-based approach. So the way that your provider might screen you for high blood pressure and then make an initial treatment plan, and then if that's not working, refer you to a specialist. That might be a way to think about a more reasonable system for substance use disorder treatment, that people are screened more routinely, that care is provided in an integrated team-based setting and well coordinated, and that referrals are made for specialty care when they're needed. So to get there, we have some priorities. We have identified drug use in pregnancy as one of the major issues in the state, so we're very interested in programs that would seek to address that through a team-based approach to providing prenatal care that also addresses substance use disorders alongside of that care. Increasing access to medication-assisted treatment in integrated behavioral health settings. Adding substance use disorders to the scope of care for federally qualified health center, rural health center, tribe or urban Indian health program. New partnerships between substance use disorder providers, mental health centers, and primary care providers. Implementing SBIRT, which is an acronym that stands for Screening, Brief Intervention, and Referral for Treatment. It's an evidence-based strategy that can be learned and practiced in primary care centers and ERs. Business development and revenue cycle support for said providers to help them help them expand services that they're providing for their communities and provide a robust spectrum of care. And developing regional frameworks for preventing substance misuse and substance use disorders. We're not going to fund a lot of smaller direct prevention efforts, but I think developing framework strategic planning to develop a strong regional approach to prevention is something that we would consider funding. So finally, in Partnerships for Better Health, some examples of key challenges that we focus on in this area. Limited access to health services in rural areas, workforce issues where it's hard to retain and recruit staff, funding where low reimbursement for mental health and substance use treatment has contributed to a fragmented and often undercapacity system, rising healthcare costs and the challenges associated with people who are now often referred to as high utilizers, people who maybe aren't getting optimal outcomes from outpatient care and so end up in the ER and hospital too frequently. And then issues of health disparities and the social determinants of health, the challenge of improving health against the current of poverty and poor housing and poor educational outcomes. So some project examples, types of things that we're likely to fund: community health teams and other approaches to care coordination, case management, and community outreach that will strengthen the safety net around high needs patients, identifying and improving outcomes among super utilizers, school-based health centers, interventions that address the upstream risk factors for health disparities and social determinants of health, with a particular emphasis on sustainability strategies for programs that do that. Direct collaboration among community agencies to address a major health issue. One of the real challenges we focus on in this portfolio is that in rural communities that are struggling often with funding and recruiting and retaining good staff, we sometimes see examples where there may be a struggling mental health center and a community health center and a critical access hospital and not a lot of direct collaboration among them. So could you strengthen your community's health system if you figured out ways to share space, administration, workforce, or what have you? And finally, oral health is a very important emphasis here as well. So I'm just going to go over a few nuts and bolts of how to apply. The grants management system that we use is Foundant. Foundant can be accessed through Montana Healthcare Foundation's website. You see a screenshot of our main website, and up at the top of the screen, you should find the grants login page. You'll click that, and it will walk you through how to get a login in the system and how to apply. All applications and grant progress reporting will be done in Foundant. We are more than happy to help you if you have technical difficulties along the way. So this is the logon page. For first-time users, you have to create an account. This account can be used for all future applications, and you can call our office if you're not sure whether you have an account or not, or if you need your login information. This is the first page of the application, and this is where you'll select one of your focus areas. Looking at the large blue arrow on the left, that's your opportunity to make sure you're choosing the correct focus area and funding opportunity. You can preview the questions for the application by clicking the preview button. Once you've chosen your area of focus, you click Apply, and then you'll be taken to the application page. So once you've completed your application, if you don't receive an email that confirms receipt of the application within 24 hours, you should contact us at info@mthcf.org. Make sure you click that Submit button when you're done. So here's the application timeline. The call for proposals opened on January 16th. The brief proposals for the large grant opportunity are due on April 7th. Full proposals will be invited on May 22nd. They're due on August 4th. Funding decisions will be made around the beginning of October, and we would anticipate that projects would start later around the beginning of November. So again, for the Q&A session, just type your questions directly into the Q&A feature. Please refrain from asking specific questions about your project. We're not going to make a decision on this call about whether we would or wouldn't fund a specific idea, but if you can frame your question in a way that applies to a broad range of projects so other participants would benefit, that's great. And if you're not sure, ask your question now, or we're also happy to have a one-on-one conversation with you or email with you if need be. If you don't have the chance to ask your question today, or if we didn't respond to it directly enough during the presentation, please email it to us and we'll respond as quick as possible. As a reminder, the presentation and the Q&A session will be recorded and archived on the website. So again, we really aim to help make this process as painless as possible, so do not hesitate to ask us questions along the way. All
right, so we only have a couple of questions in, so if you have any questions, please type them into the Q&A feature on Zoom. The first question we have is, with the large grants under IBH, which is our Integrated Behavioral Health focus area, is this only for organizations that you have funded in the past?
So not necessarily. We are asking that these be by invitation, because we'd like to have a conversation about the specifics of your project. But for large integrated behavioral health implementation grant, as you would be asked to submit a pretty detailed proposal outlining exactly the program that you want to design, and also a brief business plan and pro forma for how it would be sustained after our grant. That's going to be a very, very important window. So we'll need to see that this is really adding something new and serving the community well, and also that it's sustainable after our grant and wouldn't just be sustained based on hope of getting more grant funding.
All right, our next question is it one login per agency or per grant or per person? This is for Foundant login.
So I think the answer to that
is one per agency.
One per agency, thank you. So, and if you're a large agency with multiple people,
call us.
You call us and we'll help you get categorized in the right way.
All right. This question asks if we could go back and speak about sustainability again.
Yeah. So we think about sustainability in a few ways. When we're talking about health services or health-related services, in some cases it's services that you might be providing that actually are considered health services, and you hadn't thought of it that way. They may be billable to insurance, Medicaid, private insurance. And we've found that a lot of organizations aren't necessarily maximizing that revenue. So they're very used to being sustained based on grants and then applying for more grants after that, and there's always this big uncertainty. So we really focus, for anything that might be billable, on developing a strong business plan and sustaining the project that we've helped you get started through billing and third-party revenue. The second strategy that we have seen occasionally and that we think is viable is that if you're addressing a high needs and population that may be costing someone a lot to serve currently, and you think you can improve outcomes, say by reducing hospital readmissions or reducing ER utilization. It may be that you or partners in the hospital system would benefit from that financially. So we'd look at that as what's called a shared savings approach to sustainability, that you would be able to achieve commitments from your partners to fund that project because it's achieving such benefit for your patients and even potentially some financial benefits as well. Another way that things can be sustainable is if they leave a lasting impact after the grant. So for example, we have funded projects that involve creating a toolkit that then can be used and implemented by stakeholders at no cost, or training staff to do something new where they can then sustain that. So that's another aspect of sustainability. I'll tell you that the sustainability plans that are most concerning to us are those that say, look, you know, we're a grant-dependent organization. We're going to fund this service by you know, applying for more grants from someone else after we're done with your grant. That to us is not a strong way to really leave a lasting beneficial impact on the health system, and so we're a little less likely to fund those projects that really are likely to be grant dependent forevermore.
All right, our next question is, could you please address the planting again?
Yep, I'll do my very best. It's a nuanced discussion, and we're always happy to talk with you about it one-on-one. But in our minds, that the supplanting is sort of like replacing existing funding. If you've got funding for a program and you apply to us because you would like to use our funding to replace some other source of funding that you currently have, that is supplanting. If you have funding for a program but you'd like to build on that program, do something new and different with it, achieve new outcomes, or serve more people or a different population or something like that, and so our funding is clearly going to add to that which you already have, then that we would consider supplementing, and that is allowed. And I hope that, again, the link on the website should do maybe a clearer job than I just did of explaining the difference, and we're always happy to talk with you.
That's all the questions we have, so be sure if you have any right now, just type them in.
Yep, we'll go ahead and stay on the line for a couple more minutes. This is your big chance. Make sure to ask any questions you have. We'll keep the line open for, you know, another minute or two here. If we don't have any questions, we'll let you go. But please do ask. We're friendly. We're here to help.
And for those of you who are listening by phone, who aren't by your computers, if you have a question, please you can email me if we've chatted before, or you can email our info box, and we would be happy to answer your questions.
They can't raise their hand.
No, they can't.
Yeah. Okay. Well, I'm going to give people about one more minute. We're not seeing any questions come in. I hope the Q&A feature is working well for you. We're not trying to ignore anybody. Okay, well, if we don't get one here by the time I'm done talking, I think we're going to go ahead and sign off. I will just say we do a lot of, you know, work one-on-one with applicants as they're going through the application process. The online application system is pretty user-friendly, but we do get questions on it. So if you're not sure whether you should apply, feel free to call us. If you get into the application process and you're not sure about how to answer a question, or you're having technical problems, again, call or email us. We really are here to help. Looks like one more question may be coming in. I see. Someone typed, I have one last question. Now you have to type your question.
All right, here we go. If we are not able to partner with any of the tribes, is this a detriment to the proposal?
So if you're applying under the American Indian Health Focus Area, the answer is probably so. And if you are applying under another focus area, but hoping to have a major part of your proposal or part of your project be serving tribes or American Indian people, the answer is also probably yes. It doesn't mean that you have to have, we don't expect necessarily a formal tribal resolution, but we will look at the whole picture of exactly how you're partnering with the tribes. We really, it's very important from our standpoint and our partners in the American Indian health system that resources come directly to those communities and that projects be developed and designed in close partnerships with the communities. So we're happy to kind of look at your situation one-on-one, but you know, our closest core partners in this focus area are the tribal health directors and urban Indian health center directors, and by extension their boards and tribal councils. So we really do look at whether this is something that those organizations and communities want and that's going to fit in well with their objectives. We do fund tribally controlled nonprofits directly, but again, you know, we would want to understand kind of the nature of how you're fitting into the community and how you're working with leadership as well.
We have a question asking how many large grants will be awarded. Do we have a number?
So we do not have a number. It's a little bit, the money that we have for our charitable work in 2017 is roughly $5 million. That'll be made though through a combination of the rapid response grants and the large grants and some invited grants. We expect to fund quite a bit more than what we did last year, but we don't have a fixed target because really what we're going to do is fund the strongest proposals across all of those opportunities, so rather than setting a fixed target quota in any of them, we fund the ones that do the best job of addressing our selection criteria.